Really excited to have Ellen Agler here. Ellen is somebody I see often when we're on the road at global health conferences and events, and haven't seen you in a long time. Really nice to get to see you. Ellen, of course, is the CEO of the End Fund, which is a major global health initiative to end neglected diseases around the world. Has made incredible progress. You serve tens of millions of people around the world every year. You've, I think, had provided over 1 billion treatments so far in the 7 or 8 years or so that the End Fund has been around. And you were on my mind in particular for lots of reasons. I wanted to talk to you, obviously to get your take overall on the pandemic and how things are going, but particularly thinking about how the work of the End Fund and other groups that do mass drug distribution and campaign style global health interventions, how those have been interrupted by the lockdowns around the world. So lots to talk about. Thank you for taking some time.
Glad to be here, Raj. Thank you for inviting me.
Yeah, so maybe we just start with kind of your big picture feeling. What's happening at the End Fund? How do you see the pandemic response unfolding right now?
Yeah, well, like so many different things in global health, much has been on pause. We, really recognized that with COVID, we didn't want to be, a part of the problem, and community-based treatment, especially for something like neglected tropical diseases, doesn't cause immediate mortality. The issues around neglected tropical diseases are more long-term disability, and so the recommendation was to pause all what is known as mass drug administrations.
That was from WHO, right? And
yeah,
WHO, I think in April came out and said, pause this work.
Exactly. And we were already pausing it before that, saying like, we see the writing on the wall, we don't, and especially since we fund a lot of local organizations and ministries of health to do that work, we just didn't want to, be part of spreading the disease. And so we're already starting to roll back and pause programming. And then WHO came out with guidance, really asking everybody to pause mass drug administrations. The tough thing is, I think it's easy to say stop everything. It's hard to say when to start. And so there's just so much conversation now of like, under what conditions would we start? How would that be safe? What kind of timing? How would it need to look different? And lots of countries and partners of ours that really are clamoring to get back to work. There's been some really interesting modeling that's taken place. Like if you miss one round of treatment, what will that do? If you miss 2 rounds of treatment, and it's quite different per disease, but you really could extend out by years the timeline of reaching end goals like control and elimination. And for some of the more deadly diseases like schistosomiasis, we're already seeing it spike in hotspots and people, getting more of the disease, and it's just, quite worrying to think of pausing treatment for too long. So, now we're full into looking at what would it mean to start again, and some countries wanting to start that. I think that anything that involves gathering mass crowds is of a concern, and you're going to need to do things differently. One of the main ways
for people, Ellen, who don't really know how mass drug distribution works or what it looks like, explain what that means. Why would you gather this large crowd? How does it look?
Yeah, it's a good point. So, a campaign style, oftentimes, if you're treating at a community, you may gather everybody to main community point, whether it's a health center or a school. For deworming, oftentimes it is literally done through the schools, and teachers will line up all of the kids or bring everybody to a central courtyard. I've been at treatments for river blindness or lymphatic filariasis where you might have, hundreds of people all gathering, and it's just a sort of efficient mechanism for lining people up, measuring how tall they are. That's how many pills do you need to take? Okay, line up the next person. So it's certainly a community gathering moment. Oftentimes I've seen it accompanied by celebrations, like, okay, the medicines are arrived, we're going to take this all together. And so, that particular model doesn't work in the in the COVID world. More and more people are looking at how can we do this where community health workers are going more door to door, kind of interacting with one family at a time. Certainly thinking about needing PPE in order to do that, masks and gloves. And I think that, just ensuring that there's even more education for community health workers around how to do this all safely. I recently, just in the past week, we got a proposal from one of the countries that we work with. They're like, okay, if we can do it safely, and there's not hotspots of COVID in the regions, there is testing going on, this is what we think it would look like. And the budget came back at like 20% more expensive than the program would have been pre-COVID. And I think that's the reality that everybody is looking at. Like, oh my! And
it makes sense, right, that it would be more expensive, especially in a startup, because you are going door to door. Adherence is going to be harder. You have to track who's getting it, who's not. So it does make sense, although in the long run, you think if you have a really robust healthcare system, including community healthcare workers who already have their PPE,
Yes.
already have the training and the smartphone with diagnostics and other tools and recording tools, then in a sense you could layer in your work and it wouldn't be as costly. But we're not quite there, I guess, in many places.
Well, I know you had Raj Punjabi on recently, and I just think so many organizations that are working on frontline health are trying to figure out what does that mean. PPE for community health workers. It's like, sounds simple, we should do it. Obviously, there's not enough PPE even in the United States, and we've been getting a lot of requests from countries. Could we fund PPE for community health workers? And some of our investors like, just be careful. Like it's ripe for duplication. It's ripe for, if you give small grants to people for buying PPE, that you're just driving up competition and the cost. So how do you help centralize things? What's the prioritization of who gets PPE where? Should actually health facilities, doctors and nurses be getting it before community health workers? But I think that's quite political to say that, because of course all health workers should be getting PPE. What type of PPE is appropriate for what kinds of intervention? So I think it's, it's been really complex. And the supply chain issue around PPE. I mean, what I've been excited to see is some places just doing more local manufacturing of PPE. And
yeah,
I
I'm
think
hearing
that's
more and more about
huge opportunity for
do
lots of parts of Africa and other places in the world.
Yeah, especially if this is an ongoing thing, and hopefully it isn't. But lots of the epidemiologists we're speaking to seem to think, it's been slow in many ways to see the pandemic expand in many of the low-income countries of the world, but it's everywhere now. And so
what
it's
have you
likely
seen, Raj? I mean, because the question of what does COVID look like in Africa, I think, is a hot discussion for everyone. I've been curious what you've been speaking to so many people in this field. It's like, is it really not going to hit as hard? Is it just not hit yet?
Yeah, there's so much uncertainty, but most people seem to think it is coming, and there will be very significant negative effects in many places. Maybe not everywhere equally. Africa is a pretty diverse continent, many different contexts. But and of course you have younger populations. So in one sense, people might be better protected, but then you have lots of potential comorbidities with other illnesses, including maybe neglected diseases. So, there's still far too many open questions, but the things we do know seem to be, well, you need to have a healthcare system that's adequately prepared. You need to have community healthcare workers that are protected. You know some of the basics. If you were trying to make these investments today, I guess that's maybe a good question for you, because a big part of what the End Fund does is raise funds for a set of diseases that are neglected, or frankly, for the people who are neglected, who suffer from them.
Yes.
How has it been? I know it's only a few months into this pandemic, but in terms of raising those funds, are you finding donors saying, well, no, sorry, we're pivoting to COVID right now. The areas you focus on are not the priority today. Is that affecting you yet? How do you think about this from a funding standpoint?
I mean, I think I have a lot of, you and I both, we have a lot of friends and colleagues in the nonprofit sector who are suffering greatly right now and seeing donations fall. I mean, I know organizations that rely on their spring gala or rely on sort of everyday donors that now have lost their jobs and are not able to give so much. I mean, certainly we've had funders who, listen, I own a set of companies that employ thousands of people. I've had to let half of them go. They're hemorrhaging. They're just suffering. This is not a great time for giving. I think we're not sure. For us, we've been really lucky. I mean, some of the foundations like the Gates Foundation came really early and said, listen, we're not only not going to cut our funding, we're going to stay at least at this level or grow for the next 4 or 5 years. And I think that just giving people that stability and flexibility, and the amount of flexibility that, so like, listen, and if there's savings because you're not traveling and you want to pivot it into other things, I think it's been really generous. Elma Philanthropies is one of our partners, and it's been amazing. They just feel like we've been getting ready for this moment, and they're all in just getting more COVID response grants out the door and ensuring that their current grantees are protected. There's so many examples that I feel like philanthropists are seeing this as a moment of their calling, like really waking up to seeing like we can do something in this time, and let's not retract. Let's lean in even more. But that's not everyone is able to do that, and I think that we're not fully going to see the impact of this. Sort of a lagging indicator in a way for the next few years. I think a lot of us are worried about what is 2021 going to look like. What's 2022 going to look like? I mean, the End Fund, we were in the middle of this big plan of massive growth and expansion and working on our strategic vision for 2030. And it's like, just put that on pause and see where do things land? Because is this a 2008 situation, or is this a true depression? How is that going to affect philanthropy? And I think some of the philanthropic trends are really interesting, because there's a movement to pay out higher on the donor advised funds, possibly go above the 5% giving recommendation for foundations. So it's another area that I just find quite fascinating, that philanthropy right now could have a massive positive impact on how the COVID response and how COVID affects the most vulnerable people in the world.
And what about from the bilateral funders, the donors, governmental donors? What are you hearing from that universe in terms of how they're responding at this point?
Well, I mean, I think that it's different depending on the bilateral. I mean, two partners, they're not funders of the N Fund, but that we collaborate with a lot, are the UK's Department for International Development, and then the US on USAID side. And USAID, we're seeing that there's like a real earmarking of funds for a particular issue, and just like hold tight with those funds. So the NTD funding has been really protected. On DFID side, I think they're looking a lot more like, where can we find additional COVID response fund? And so there has been a little bit of a pivot from NTDs to COVID funding. One of my biggest concerns about the bilateral funding from the US side is just funding for WHO. I mean, there's a pause on additional funding for WHO, and that's supposedly for 60 to 90 days, but I think we have concerns that that's going to go on for longer, and potentially much longer. And actually, the US government funds some really pivotal things within USAID. I mean, even within the neglected tropical disease space, it's like the monitoring and evaluation function. If you want to prove elimination of your disease, you have to submit your dossier to WHO. I mean, the technical, all of the countries are looking to WHO for guidance. And so for me, this is a time that the whole world should be leaning in and supporting WHO. And it's been really tough to see that the US response has been so problematic related to COVID in these times, and supporting WHO.
Yeah, even if it just slows down WHO's ability to respond to organizations like yours, that can have a really significant ripple effect.
Yeah, I think one of the things we found is the community that the N Fund works with, are the way that things like Mass Drug Administration work is, you have key partners at the Ministry of Health, but then you're activating literally hundreds of thousands of community health workers across dozens of countries. And these are people who are committed to treating infectious disease, that want to be in service of these times. And while at first we thought, okay, let's not try to get in the way of COVID response, it became really quickly clear to us, it's like, actually, this community could be of use. And there are some real clear overlaps between preventing COVID and preventing some of the neglected diseases we work on. I mean, in some ways, we were always dreaming that there would be a more attention globally on hand washing, and we couldn't have asked for like the more obvious global hand washing campaign that's happened now. Like,
and
more
a
people are
lot of
talking
that's
about
because
hand washing than ever. And in the
a lot of that's
communities that we
work on intestinal worms, right?
Yeah, right. So washing your hands is one of the best treatments for intestinal worms, just that basic sanitation. And our hope is that the message for hand washing isn't only that it saves lives from COVID, but it also saves lives from lots of other diseases, including preventing intestinal worms and preventing the transmission of blinding trachoma and other things. So we have, in the work that we've done on our COVID response, it's really been, how can we leverage the NTD platform uniquely? How do we do things that might both support neglected tropical disease control and elimination and support COVID work? And then just thinking about activating our network of advocates. Like, we work a lot with the net partners at the First Ladies Alliance, and with a lot of African First Ladies, with Common Goal. That's a group of soccer players that have worked with us on NTD response. And at this particular time, we're saying, like, how can we help support your networks to work on COVID advocacy and evidence-based prevention messages? So it's been really rewarding to people to do that.
We got a question from somebody who works at the World Bank, because you were talking about the 2030 strategy, and we've talked a lot about the kind of immediate effects, and they want to know, what about midterm effects? So, engaging the at-risk communities through maybe different means, like more cost-effective IT means. Like, do you see any major reform or a new way of working that could potentially come out of this crisis that we're facing?
Yeah, I think we're looking at a lot of things. Like, we're looking at what can we do to accelerate progress once we can start treatment again. So there's analysis by disease of if usually you would do one round of treatment per year, what would 2 rounds of treatment look like? How do we package other services? It's not only NTDs that are obviously affected, but HIV, malaria, TB. So there's a lot more discussions happening at the integration level. of how do we, and I think that's actually a real silver lining of this, of like, how do we do better integrated services? Because there is in global health sort of like these disease focuses, and all of us get so busy working on our individual disease that we're not, connecting the dots enough. So I feel like that is definitely happening. And then technology, for sure, I have sort of a personal reflection that I've spent so much of my time on the road, and so does our entire team. And I would have considered it almost rude or inappropriate not to show up in person for some of these meetings. And people that I would have never imagined would be like, on Zoom and super effective at every level of the government that we work with, and partners in countries that I was like, I didn't realize their bandwidth was had gotten good enough to do this big Zoom platforms. I mean, it's amazing the amount of work that's happening remotely now. And the whole world, like, it's a bit like in the education sector, like people who weren't big fans of online learning all of a sudden are figuring out there's benefits to online learning. I mean, I have a 10-year-old daughter who's like, I think I can get all my work done in a shorter amount of time if I don't go to school, Mom. And so I do feel like all of us are finding those efficiencies and like thinking about what's the future going to look like in terms of how we use technology. How do we do global convenings and global advocacy? I mean, next week is the big Gavi replenishment meeting, and they're doing it all online. You saw the big COVID replenishment meeting, and I think these are all big global meetings that where we usually run into each other, Raj, and cross paths that are now people are really having to rethink. Is it necessary? And I think that is a beautiful underlying question. Like, are some of the things that we've always done necessary? And I mean, for me, it's also this like slowing down and allowing yourself to be changed by this moment, allowing your organization to be changed by this moment, like saying like, what can we get rid of? So I mean,
what do you think from an advocacy standpoint, though? Because you're right, thinking about all these major replenishment meetings. A big part of what you do so effectively is to go there and buttonhole ministers and twist arms and convince people that, hey, this is the best buy in the world, is to fund NTD prevention. How do you do that if you don't have access to some of these folks who are difficult to get access to anyway? Maybe health ministers are easier, but what about finance ministers?
I know. I don't know. Do you have any advice for me on that front? Because I worry about it a lot. Do I see a little person behind you? I think I see a head popping up.
You see a. Come here. You want to be visible in this video for a second? Joining many of my interviews. This is yeah.
Good to see you. Yeah, because what I'm finding now is it's easy to like maintain relationships. You can definitely continue conversations that you've met and worked with people, but like meeting new people, cornering. I might be able to corner and get a conversation with the head of state if we're at Davos together, Raj, but I'm like, they're not taking my webinar, requests right now, or like I need to Zoom. Although I did just get introduced to a new Minister of Health by webinar. So okay. I just feel like we're finding different ways. It's funny, some of the like Skoll did some amazing convenings, and I found just like one-on-one chats with people like, oh, I see you're on this platform, and hello, how are you doing? Or I saw we're all figuring out new ways of networking. I think relying on your existing network and asking for, can you still open a door in these unique times? Oh my God, can I bring my daughter in? We can have like kissing on both sides happen. It's adorable.
Yeah, I do wonder.
I would be curious because you're talking to so many people, Raj. I do worry about that aspect of it.
Well, I wonder whether the fact that we can't get together in person and have those big moments is hurting us in terms of a really big push around global health funding today, because there have yet to be. I interviewed Mark Lowcock, who talked about a $90 billion plan for humanitarian response. Mark Dybels talked about $30 billion for public health. Yeah, but it does seem there's something of a lack of ambition at the moment when it comes to global health strengthening. That you're not here. You're hearing trillions of dollars in stimulus for the richest countries in the world, but nothing comparatively ambitious in our space. That's at least my sense. What's your sense about it?
I think you've hit on something really important, because I think what we hope would happen in this moment is everyone would realize the answer is strong health systems, not only in my backyard, but every corner of the planet. And we need to lean into that. Like Larry Brilliant said recently that he's like, it's not just that we're living in the age of a pandemic, we're living in the age of pandemics. And people have to get their mind around, like, this is going to be just one of many that we're going to be facing more and more frequently in our lifetime. And the only way to deal with that is by rapid detection, rapid testing, rapid response. And the strength of frontline health workers and the strength of health systems is the project of our lives. And I think you're right. Like there isn't the, and I think it's been really tough because I think from a funder's perspective, it's always like, well, we don't want to put money generally into health systems. That sounds very vague and diffuse. And so picking diseases that you can have clear outcomes, or picking a specific niche that you're going to get your handle around. I mean, I understand that. Like, what problem can I solve in my lifetime? And when you think about strengthening health systems globally, it's hard to understand that. But I do feel like this is hitting people so personally right now, and it's so clear. I do think maybe DevEx can help lead a conversation on what do we do to get to that $1 trillion health system strengthening fund that's needed.
Yeah, I think you hit the nail on the head that it's hard to get the political support for something as general as health system strengthening. And that's on both sides, the donor and the country government, where sometimes you see initiatives that get invested in and then countries don't pick them up and they're not sustained with government funding in the long run. So yeah, it's absolutely a real challenge. You know, the area you work in was, for me, one of the big bright spots, where we say, hey, 20% of the world is affected by these diseases that have been around forever, but there are really inexpensive ways of addressing. Drug companies have largely donated the medications. It's just a question of closing that last mile, 50 cents, you know, numbers like that per person per year to address these things. And a lot of global health experts I was speaking to pre-pandemic thought, we'll eliminate, just as in your name, the End Fund, we'll actually eliminate some of these diseases in our lifetime, like maybe in the next decade or so.
Raj, we still will.
Like,
we're still on track.
That's my question.
I am actually not worried. I feel like this is a bump in the road, and we're going to have to figure out a different way of working. I still feel that story is true. These diseases have been around for thousands of years. There's now a way to address and tackle them. And within the next decade, we should go from, you know, a 90% reduction of everybody in the world. Even the time since the End Fund was founded in 2012, 300 million less people need treatment for neglected tropical diseases. There is a chance to go from the 1.7 billion people who need treatment now down to, you know, to just a couple 100 million by 2030. And all those things are still on target. I think what's really interesting for those, you know, who'd want to look up what the new World Health Organization roadmap is for 2030, is there is a lot more clarity about how just neglected tropical diseases that affect so many people link with health system strengthening. Like, how do you create platforms for the diseases that affect skin or diseases that affect blindness? How do you embed referral systems better into the health system? And I do feel like that, you know, how do we all, even if we're working from a specific lens of here are our main targets, how do we all think about how that connects to improving water and sanitation, improving health systems, and just work more effectively as collective actors? But I'm actually still incredibly hopeful. And I think that this particular time of awareness, we may even get more attention for the things. A lot of times neglected tropical diseases get attention for the delivery of medicines and that aspect of the treatment. But I feel like there's so much emphasis on prevention now, you know, whether it's the water and sanitation, hand washing, and the complementarity of that is just going to help fast track us for elimination goals.
Yeah, I'm glad to hear that you're still optimistic about it. And I know, you know, obviously polio and guinea worm were sort of two potential global eradication stories that are so close, tantalizingly close. And I think if you can get those, it sure gets the world's attention on the potential, and maybe helps to raise more funds for the End Fund and other groups. What are you hearing? I'm curious from your NGO partners, because the way I understand the End Fund, correct me if I'm wrong, is you do the global fundraising, the program design, the impact evaluation, but you're really partnering with local groups. You're not actually running those campaigns yourself.
True.
And so what are you hearing from those local groups in terms of their ability to stay in business and be financially sustainable when they're not getting funding to do mass drug distribution and other kinds of health work? What are you hearing?
Well, we fund a whole range of organizations. So in some places we're funding the Ministry of Health directly. Other places it's a larger, you know, international NGO that has a branch in that particular country. Other times it's very local, you know, local organizations. And we really have been lucky with our group of investors that have said, like, hold strong, don't let anybody be let go on the ground. And if they need to pivot to COVID response like now, let's encourage that. So there's a ton of people inside the Ministry of Health who've just been swept into the COVID response team. And so they're really utilizing expertise from their NTD world to respond to those. I think there's a concern if this, I mean, I would say, you know, 6 to 8 weeks ago, we were worried, like, is this going to go on forever? We're not going to be able to treat at all this year. And now there's just a lot more clarity of, okay, there are some spots that we could start. It might need to be on a smaller scale. It might be more expensive with all these safety precautions, but the downsides of not continuing treatment are significant. So I feel like actually we just had a big webinar with the World Health Organization on this topic a couple of days ago on getting back to business and what does that look like and what should the guidelines and risk analysis be. And there were hundreds of partners online, and you could see there's like just a lot of momentum and enthusiasm to get started again. So I'm honestly more worried about my friends and colleagues that are not in NTDs and the global health, because I'd say that people I know that run nonprofits that work in the arts and education, I mean, completely different than what we're talking about here today. It's just, the thought of who's going to be going back to Broadway and who's going to be, doing in-person events anytime soon is pretty tough. But I feel like this highly localized, and I think that's where like localization and supporting local partners who understand their context really, really well. I mean, the partners that we have that are working just in the Eastern DRC or work just in this, particular state of Nigeria, we're getting the best information on the ground of what the particular context is and how to move forward quickly. So I feel in a way like what's happened to me is the end fund model has just been proven out during this period. Because it's like, okay, we have this diverse, dozens of local partners across many countries. It's not reliant on like headquarter staff going to the field and having to, implement programs that way. It's really so much is about supporting frontline community-based organizations. So I feel quite optimistic.
And other groups that don't have that model might find they're forced into it just because you can't travel, right? And it may be quite a long time before their staff wants to or willing to travel, before guidelines come, allow them to do so. So you kind of have to localize.
I know, and I think that's sort of a silver lining of this all. I mean, that's something we've been talking about for so long, and it's hard to change superstructures. And one of our funders always talks about in the investment world, when you have mass disruption, refers to it as an unfrozen moment. And in that unfrozen moment, when things haven't yet gelled back, that's your greatest opportunity. And so I feel like for those of us working in this space, it's like, it is an unfrozen moment. How do we not go back to the way things always were? And what have we been trying to change for a long time that actually now is the chance to get those changes through?
How significant do you think this is going to end up being? You talked before about whether it could be 2008 or it could be more like a Great Depression. I mean, just in terms of the way the global health and development community is going to be reshaped, do you think this is going to look like a totally different aid industry, a few years from now because of this moment we're going through now? Or is it going to be more of a slow iterative shift? What's your feeling about it? We ask this poll question of our development professionals every week.
What did everybody else say?
In our DevEx
watched all the interviews first.
Yeah, it's interesting.
So hard.
There's no common opinion. What do you think?
Yeah, I mean, I'm by nature an optimist, and I do believe in this, the moral arc of history bends toward the good, and that people are waking up to new forms of capitalism, new forms of living together. And in that is an awareness of our interconnected nature, this single planet and this single health ecosystem. Like the link between human health, animal health, and planetary health is just getting more and more obvious to people. So I do feel like, in the sense of the global health, I don't even know if we should call it the aid industry anymore, but it's certainly like, how do we promote a global well-being? That percentage of funds that go to solving that problem is just going to need to increase. And you see that, like strong economies spend a significant portion of their dollars on health. And so I think moving that needle to whether it's domestic resources or global resources, I think that, we're going to just see an increase in focus and investment. And also because I think that there's so many really evidence-based ways that people can see that you actually can make improvements. And I mean, I have a tendency to think like the 100-year view, like think about what life was like in the United States 100 years ago, and the lifespan was still in the 40s, and we were riddled with infectious disease. And so you take the long view, like what can happen to human health, animal health, and planetary health over the long term, but we just need to keep leaning in that direction. And so I feel like there's more and more people that are in positions of influence for influencing, whether it's capital or mindsets, that really are embracing that these days. So I'm quite hopeful.
I'm glad to end the discussion on a real moment of optimism, because I also tend to be an optimist too, and I see a lot of potential. But it does feel to me like this is a moment in time, that we have to we have to seize it and make that case, the exact case that you're making. So thank you for taking some time to share that with all of us. Thank you to everybody who's been joining us live from all over the world on
Thank
YouTube
you.
and on
What a
LinkedIn.
delight to speak with you.
And it's so good to see you. Thanks to you and all your colleagues at the End Fund for the good work you're doing.
Thank you so much, Raj. Really appreciate your partnership.